వెల్కమ్ టు ఇండియా నెక్స్ట్. ఇవాళ మనతో పాటు ఉన్నారు డాక్టర్ శ్రీనివాస్ జే, హూ ఇస్ అన్ ఎమర్జెన్సీ అండ్ క్రిటికల్ కేర్ స్పెషలిస్ట్ ఫ్రమ్ సిమ్స్ మాదాపూర్, హైదరాబాద్. నమస్కారం అండి.
గుడ్ మార్నింగ్ అండి.
హలో సార్.
చెప్పండి.
సార్, మాకు కొన్ని ఇన్ జనరల్ చాలా డౌట్స్ ఉంటాయి అబౌట్ ద క్రిటికల్ కేర్ ఎనీబడి. బికాస్ మామూలుగా అంటే ఎవరి స్పెషలైజేషన్ వాళ్ళు తెలుస్తుంది పలానా డాక్టర్ అని. వచ్చిన ఇబ్బందిని బట్టి ఆ డాక్టర్ని ఎవరైనా అడ్వైస్తోనో ఉన్న నాలెడ్జ్తోనో అప్రోచ్ అవుతాము. But when it comes to emergency care, how do you handle the different kinds of health issues, sir? Because people from all kinds of health issues come and join there. So how do you identify, differentiate, or how do you handle those critical care?
Basically, critical care medicine is completely different from the general medicine or other surgical branches, because here the human body behaves in a completely different way when compared with the what we generally gain knowledge from our MBBS or MDs. So it's a specialized training program, 3-year training program, post MD doctors to understand about the physiology, anatomy, and the treatment about these patients. So we take care of patients of all branches. Like we take care of patients with a neuro problem and heart problem and lung problem, abdomen problem, and urological problem. Everything when they are in critical situations. So these all body organs functions in a different way when it becomes critical. So that's how. And also these all organs are interdependent, so all are, so one organ fails, it has a impact on the other organs also. So that's the reason why even critical care specialist is mostly called as a multi-organ specialist. So we deal with this all the organs. So whenever we are treating these patients in association with the concerned specialist, we coordinate with them, we give our inputs to them, and then we treat the patient. So it's a critical care medicine is a team approach, so for the best outcome of the patients.
So how does a typical day look in a critical care doctor's life?
Yeah, basically there will be a lot of stress in the critical care medicine, in the critical care unit, because the most of the patients are sick.
Yeah.
And it is not only the professional part we look into this, because there is a lot of other things also, patient family emotional things patient family will be facing. But we really look into the patient and we prioritize our patients and treat. The day starts with hectic, and we prioritize our patients and treat the patients.
So how do you prioritize, sir, if you have multiple patients?
Yeah. So what we do is we take, typically in the morning we take a handover from the night doctor and night ICU specialist. So we prioritize which are the patients which are very sick. So these sick patients we approach faster, early, and treat them, and we update the patient family members.
Okay.
So that's how we go. By the first 2 to 3 hours, we have a plan of that ICU, and then we follow up frequently.
Okay. What is the most common emergency cases you come across in day-to-day life?
So most of the common emergencies we come across is breathing difficulty.
Oh.
Okay, one of the most common things, because breathing difficulty can be because of heart problem, lung problem, or any other problem, infections in the overall body. So almost 20 to 25% of the patients present with a breathing difficulty in a generalized hospital. Okay, but there are different specific hospitals. If the cardiac hospital, then the patients go with a chest pain. So other than in a general hospital, usually come with a breathlessness.
So ఇదివరకు మీద ఇప్పుడు టెక్నాలజీ ఆల్సో ఈస్ ప్లేయింగ్ ఏ లాట్ ఆఫ్ రోల్ ఇన్ ఎవ్రీ వర్టికల్ ఇన్ ద లైఫ్. సో మీ క్రిటికల్ ఎమర్జెన్సీలో ఇప్పుడు రోబోటిక్స్ సర్జరీస్ వచ్చినట్టు, వేరే ట్రీట్మెంట్స్ వచ్చినట్టు, ఫార్మసీలో వచ్చినట్టు, క్రిటికల్ కేర్లో కూడా ఆర్ యూ టేకింగ్ ద హెల్ప్ ఆఫ్ AI and other tools, technologies?
Yes, and so what we are doing is nowadays we have ultrasound machine.
Okay.
So we are previously, suppose a patient ఊపిరి తీసుకోవడానికి కష్టమైన దేంతో వచ్చినా, what we used to do is we used to have X-ray తీయడము, తర్వాత doing some specialist coming and doing and identifying cause. Now we do ultrasound in the patient, and we immediately identify the cause. What is the cause? One. Second thing we have, as you explained us, that we have a advanced technology now, like ECMO. సో
Okay.
పేషెంట్ని ఎక్మో పెట్టి మీరు విని ఉంటారు చాలా మంది పేషెంట్స్కి ఎక్మో పెట్టి పేషెంట్ సర్వైవ్ అయ్యారు బికాస్ ఆఫ్ హార్ట్ ప్రాబ్లం కానీ లంగ్ ప్రాబ్లం కానీ
So what is
పెడతాము.
it exactly, sir?
So
ECMO?
it's a artificial support system of both the lung and the heart. We put on a machine,
So it's
and we
ventilator kind.
ventilator కాదు, most advanced than the ventilator.
Okay.
ECMO we put it, and then అది ఈజ్ అ వెంటిలేటర్ లాగానే ఈ మెషిన్ పెట్టేసి we take the support of that and background disease we treat. So this
Oh,
gives the support until the background disease gets cured. So
okay,
this is
okay,
only a support system. And
okay.
so AI, what we do is our patients we monitor. Now we have a lot of tele ICU monitoring systems. So
Oh,
we, along with that, we monitor continuous online, and a lot of AI is integrated into it, so that we know we can early identify these patients which are sick.
so what would be the protocols you follow while handling the critical care cases or their family
Hmm.
or the case studies, sir?
Yeah. So critical care medicine, we follow a lot of protocols because it's a team effort. So both
Mhm.
involves doctors, nurses, respiratory therapists, and technologists. So there are, suppose a patient coming with a chest pain. So we have a pathway in that. So we follow all that pathway. And suppose any patient come with a breathlessness. So we follow a different pathway. So we have a set of protocols and systems in place, so that we don't miss any diagnosis and treatment in these patients.
Yeah, there will be a lot of mental trauma with the patient and the families. You need to handle even them. Kana. So how do you handle them? You deal them alone or your team? You need a team to support.
Madam, see, what we do is, in a patient, suppose comes with a, as I mentioned to you, that we are dealing with a multi-organ failure.
Oh,
So when a patient comes, we have a patient with a cardiac failure, lung failure, liver failure. So, and also mental trauma also will be there. So we have a concerned specialist doctors, and along with the ICU specialist, and also we have a social worker in this, and also a
oh,
nurse also in this team. So
okay.
we go to the patient family members as a team approach. So the medical things we, our doctors team deal, and emotional things the social worker will be dealing with this. And also, suppose if they have any financial issues or something, our billing team, we explain to the billing team that to take care of them